Hi, I'm Mark Butcher, and today I'm at a private healthcare centre in London to learn about cardiovascular disease and whether I'm at risk from it. Cardiovascular disease remains the largest cause of death in the UK, and while serious progress has been made in diagnosis and management for the over 65 age group, the death rate in under 65s has risen. The recent tragic death of cricketing icon Shane Warne from a heart attack highlights the importance of early diagnosis of people who are at higher risk of developing cardiovascular disease. And that's the main reason I'm here today. Despite being fit and active for most of my life, am I also at risk of developing cardiovascular disease? I've also persuaded my fellow former pros, Key and David Gower, to do the same. I'm here with Dr Balvinder Wasan, who's going to put me through various tests.
Hi Mark. A lot of examples recently of particularly sports stars who've had heart trouble previously was been undiagnosed, and so we're keen on sort of making people aware of their risk of having heart trouble. And then onto the test, we're going to do a resting ECG, which you probably had before, which is a sort of snapshot of the electrical activity of your heart. We'll put some stickers on your chest and take the reading. We'll then move on to an echocardiogram, which is an ultrasound of your heart. That will look at the heart structure and function, show us that hopefully everything is working as well as it should be. And then the one that's sort of really pertinent to work out about whether we can do anything or you are at risk is called a CT coronary angiogram. And that's slightly invasive. They put a needle in your vein in your arm, and they'll give you, in lay terms, dye. We call it contrast. As that contrast goes through the arteries of your heart, we will be able to see if there's any beginnings of problems furring up the arteries, which might mean sort of some recommendations we can make to you to reduce your risk going forward. And then when you've had all those tests, we're going to bring you back in, go through the results, hopefully give you a clean bill of health and carry on as you are.
So the echocardiogram is the ultrasound of your heart. We're just going to look at the structure of your heart with it, make sure it's pumping appropriately. So what I'm doing now is looking up at your heart.
Right.
But more importantly, I'm looking around your heart to see if there's any fluid around your heart that shouldn't be there. Okay, good. Scan is done.
Well done.
Right, I'm going to do some measurements on all of that afterwards. But now we can start the ECG, electrocardiogram.
Yeah.
Hello. Hi, my name's Manpreet. I'm one of the physiologists. I'll be doing your ECG and your ILR download. I'll just be putting a few stickers on your chest, your arm, your shoulders and your legs. And that will be recording your ECG, which is an electrocardiogram. So this will essentially look at the electrical activity in the heart. Right, so I've saved that report and I will type it up and send it to Dr Wasan. So for now, I can disconnect the ECG and that's all done.
I've just had my CTCA scan, which was very, very good actually, very quick, very professional. The machine was very quiet. The two operatives were extremely clear in terms of what I was going to feel. All in all, it was over and done within about 5 minutes' time, and they should get some terrific pictures and images as to what's going on under the hood in terms of my heart health, so that should be great.
Well, the first thing is that when you get the right result, that's reassuring. And let's face it, the whole point of, at a certain age, having people basically look inside you is to make sure there's nothing looming there that's going to come and bite you somewhere nasty soon or later.
For the last 3 years, it's been a bit of a journey for me because I've had a mini stroke and then didn't really know why. And then probably a couple of weeks ago, actually, they said that I had a tiny little hole in my heart, which is quite common. And the good thing is that actually I've been on the right treatment for that, the right medication, which, as I said in there, it's no real hardship that for me.
To have the whole thing done properly, easily, quickly, and obviously to come up with the right result is time well spent. And I will leave here reassured, with a spring in my step, vowing to do more exercise or to keep moving and keep the body going. And we'll prepare for a few more years yet.
I actually feel like I have more peace of mind now than I did before I walked in, which is when you have health scares, that's all you want. You just want to know you're going to be all right. And I feel like now I've got more information that's going to put me in a good spot. If you have anything, just go and get it checked, because it's very simple actually, a lot of the time, the treatment that you need, and it can make a big difference.
I've had all of the relevant tests and my consultation with Dr. Wasan, and fortunately, I've been given a clean bill of health. However, it is so important that everyone gets regular checks to spot any early indicators of cardiovascular disease, particularly if you're in a high-risk category. Today has shown me how quick and easy these tests are. Not everyone needs all of them, but even getting a simple checkup with your GP to test your blood pressure and cholesterol levels will ensure any red flags are spotted. It's never too early to get yourself checked, and early action saves lives.